about the medical entomology and careers. So, medical entomology overview. Medical entomology is a specialized branch of entomology that focuses on the study of insects that relates to human health or public health perspective. That is medical entomology. In a other sense, medical entomology deals with the insects that relates to the public health issues. So, key principles is vector biology and identification. It is the most important to identify the insect that causes diseases in humans. Vector pathogen and host interaction. It concludes about the insect and the disease causal agents. Integrated vector management, it's about control, mainly mechanical, biological, and chemical control. When we applied these three control collectively, it's called IVM to control the vector. Environment and ecological considerations, it's about the manipulation of environment and disease about the environment. Public health and community engagement, it's also a very important thing to involve the public, general public, to control the vector that causes diseases. Innovation and emerging technologies. As the time passes, the insect creates resistance against different control methods and insecticides. That is why research plays vital role in controlling the vectors that causes diseases in humans. So, role in public health, as discussed during the principal, medical entomologists plays a crucial role in public health by identifying and mitigating the risk posed by insect vectors. By studying these vectors, health professionals can effectively develop prevention strategies and interactions to control disease outbreaks. The knowledge helps in formulation of public health policies and support efforts in vector control programs to safeguard communities. So, next we will see the understand core principle of medical entomology, identify major insect vectors and disease, analyze public health challenges, recognize control strategies, recognize vector control strategies too. And at the last, the career in medical entomology. So, insect and public health threats. Vector-borne diseases. Vector-borne disease such as malaria, dengue fever, Zika virus, typhus, leishmaniasis, and Crimean Congo hemorrhagic fever pose significant public health challenges. Insect like mosquitoes, like lice, ticks, and sandflies are the primary transmitter of these diseases. Vector-borne diseases account for more than 17% of all infectious disease, causing more than 700,000 deaths annually worldwide. They may caused by parasites, bacteria, or viruses spread by medically important insects. So now we see the insects that are medically important or in medical entomology. That is, first one is mosquitoes. The real-time pictures also displayed in the presentation for more understanding of the insects about their physical characters and looks. So first of all, we discuss about the mosquitoes. It is Aedes. Aedes mosquito spread chikungunya, dengue fever, lymphatic filariasis, Rift Valley fever, yellow fever, and Zika virus. If we talk about the chikungunya, it's first came in 1952 in Tanzania, reported in 1952 in Tanzania. It's a long-term joint pain, and it's a viral disease that with no medicine, only symptomatic treatment is done by the physicians. Secondly, dengue fever. The dengue fever is also called break-bone fever. It's also viral and no vaccine is available yet. Only symptomatic treatment is done by the physicians. Lymphatic filariasis, which is also called elephantiasis. Elephantiasis is a parasitic parasitic worms or viral worms, leading to cause permanent disability. So elephantiasis leading to permanent disability, and so far no proper treatment is available, no proper only symptomatic treatment is available. Next is Rift Valley fever. It is also viral, and viral to humans and livestock also. Rift Valley fever remains for 5 days approximately, short-term fever, and no proper vaccine is available. And next is yellow fever. It is also a viral and short-term fever. It's also called, it is just like jaundice, hepatitis A, in which the white portion of the eyes becomes yellow. No proper treatment, only antibiotic given to cover this yellow fever, and it is a short-term fever that recovers itself automatically. Next is Zika virus. Zika virus, if this virus come through the Aedes mosquito, through the vector into the pregnant female, then the the uh, child born with short head, that is called microcephaly. It is permanent disability that caused by this Zika virus. So far no treatment is available of this virus. Next is Anopheles. The major disease caused by the Anopheles is malaria, that cause most humans death ever made. That is why mosquito is also called the human enemy number one, because of its death toll. Lymphatic filariasis that already discussed before is like elephantiasis. Next is Culex. Culex mosquito causes Japanese encephalitis. Encephalitis means brain problem. In this, the brain swelling occurs. No proper treatment is available of it is infection of brain, viral infection, and it is persistent problem. If once Japanese encephalitis happens, then the life of that person is not normal again like before. Lymphatic filariasis is like discussed before, it is elephantiasis. And last one is from the mosquito is West Nile virus. It also called encephalitis like Japanese encephalitis, and by the same virus like Flaviridae. So these are the diseases, deadliest diseases caused by the mosquitoes, with mostly with no antibiotics, no medicine available, or no vaccine available. Only symptomatic treatments done by the physicians. Next one is black flies. Black flies cause river blindness or onchocerciasis, the disease name. It is parasitic disease, parasitic worm, second most common cause of blindness after trachoma. So you can imagine, second most common reason of blindness. 18 million people annually got blind by this disease, and about 120 million people is at risk of getting blind due to this black fly disease. So it is much important. And that and next one is fleas. Fleas cause plague. Plague by the Yars, it is bacterial disease by Yersinia bacteria. It is also called bubonic plague. It kills most in the human history. If any disease kill, any epidemic kill the human beings, that is plague. Uh, Plague is kill after Spanish influenza. In 1918, Spanish influenza epidemic kills the most human beings in the history, and after that, plague kills the most human beings. The next one is tungiasis. It is also skin inflammatory disease that is caused by fleas. Next one is lice. Lice cause typhus. Typhus is a fever like pneumonia, and it's a short term and covered by the antibiotics. Next one is sandfly leishmaniasis, caused by the sandflies, and it is also a protozoal parasites. It is also called Kala-Azar fever and covered by the antiparasitic medicines. Next one is ticks. Ticks called CCHF. It is viral disease, and its death rate throughout the world is 10 to 40%. And if we talk about Pakistan, it's about 25% death rate if this disease occurs to anyone. It is antiviral and covered by the ribavirin antibiotics. It can cause paralysis to the face also. And next one is Lyme disease. Lyme is a bacterial disease that creates spots on the body, just like leishmaniasis, and it can be covered by the different antibiotics. Next one is relapsing fever. Relapsing fever is also a bacterial disease, and as it can be covered by different antibiotics. Next one is rickettsial diseases. A spotted fever by the for example, spotted fever means it causes spots on different body parts, and also can be covered by the different antibiotics. Next one is tick-borne encephalitis. Whenever you see the word encephalitis, it relates to brain inflation. If brain inflation occurs, won't be normal ever again in lifetime. So it is also a dangerous one. So next one is tularemia. It is also called rabbit fever or bacterial, and it can be covered by time or by different antibiotics available in the market. Next vector is triatom bugs that cause Chagas disease, American trypanosomiasis. ZZ flies also called trypanosomiasis or sleeping sickness, but triatom bugs called American tribe because it's mostly occurs in America. That is why it's called American trypanosomiasis, or ZZ flies called sleeping sickness in Africa. That is why it is called African trypanosomiasis. Or the both are parasitic diseases and can be covered by anti-parasitic medicines or antibiotics available in the market. So these are the deadliest diseases caused by the vectors. You can see most of the diseases. You can see most of the diseases still under developing vaccines. No vaccine is available in the market, or causes permanent damage to the human body and even causes death. So these are the real-time pictures of these vectors as discussed in the last slides. Mosquitoes, that is Aedes, Anopheles, or Culex causes deadliest diseases. Black flies that cause as discussed, fleas, lice, and sand flies that cause leishmaniasis, ticks, triatom bugs, and ZZ flies that cause parasitic diseases. So these are the real-time pictures of vectors that in medical entomology we are trying to control these vectors, actually these insects, to stop causing diseases or spreading diseases from the diseased to the healthy. These insects basically carry that diseased organism. Either it's viral, it's bacterial, or it's parasitic. So these insects carry these disease causing agents from the diseased one to healthy ones. It may also carry from the animals to humans, as in lice. That lice carry taken disease causing agent from the mouse and then to the human. So they can also become a source to carry the vector from animals to humans also. Humans to humans and animals to humans also. So major vector-borne diseases in Pakistan is dengue, malaria, chikungunya, leishmaniasis, and Crimean Congo hemorrhagic fever. I Now we talk about the urban pests. Most of these pests are not involved in medical entomology, but I put this slide because they cause economic losses to the humans. So when as a medical entomologist we are controlling the bugs, mosquitoes, so we have to deal with the other insects also that causes economic losses to the humans, which includes ants, cockroaches, termites, and stored product pests. Resistance and control challenges. In recent years, the emergence of insect resistance to pesticide has posed major challenges in controlling vector populations. This resistance complicates efforts to manage disease transmission and underscores the need for integrated pest management strategies. Research in medical entomology focuses on developing new control measures and understanding resistance mechanisms to ensure effective vector management. It is very important. Research in medical entomology is very important to control effective vector management. Impact of climate change. Climate change significantly impacts insects population. It mostly increases the insect population and spread of vector-borne diseasing. Rising temperatures and shifting precipitation patterns can alter the distribution and life cycle of insects, potentially increasing the risk of disease outbreaks. Understanding these environmental changes is vital for anticipating public health threats and formulating adaptive strategies to safeguard communities. Basically, we all doing this to save human lives. So let's talk about the last portion of today's webinar, that is careers. So before career, how to become the medical entomology? It is much important than to take the career. So successful career in medical entomology require a mix of scientific knowledge and practical skills. Educational pathway to become the medical entomology is typically include obtaining a degree in biology, entomology, zoology, or public health degree. Or you can take medical entomology even after agriculture entomology, then you can do specialization or MPhil, MS degree in medical entomology. Internships and field experiences are equally important for gaining practical skills and networking within the industry. So career opportunities includes educational institutions, specialized training, career pathways, emerging research focus, international collaborations. Mainly, we can say academia, government, and private sector. If we talk about Pakistan, medical entomology careers in Pakistan, then in government sector, we have opportunity to provincial health departments in Punjab, Sindh, KPK, Balochistan, like medical entomologists to control the dengue, leishmaniasis, sandflies, etc. And in national health, NIH, Islamabad National Institute of Health, and Pakistan Atomic Energy, that is doing research in sterile insect techniques to stop the breeding of insects that carry diseases from one place to another place. And research councils like PCSIR and universities and colleges. In universities and college, you can, as a research assistant, research officer, or like lecturer, assistant professors in entomology, zoology, biology departments to teach medical entomology. And if we talk about the private sector, then it's vector control companies, pest control firms, especially urban entomology, like commercial industries, etc. United Nations organizations like WHO, UNICEF, in which surveillance training, emergency vector control, etc., or NGOs working in public health or emergency relief. So that's the major opportunities in Pakistan. If we talk about the abroad international opportunities, then there is a strong international demand for medical entomologists, especially in region facing outbreaks of mosquito-borne or tick-borne disease. Many of disease role offers research, control, or emergency response opportunities. Like in, if we talk about Middle East, then for dengue and pest control roles like Saudi Arabia, UAE, Oman, even Saudi Arabia is continuing the research on Aedes aegypti, that how to control the vector or how to control the disease in university, in major universities of Saudi Arabia, or in UAE. You can say in 2024, urban flooding in Dubai, and a lot of cases of dengue has been is being reported from Dubai, and also from Pakistan, that has travel history to Dubai. In Africa, we can get jobs in malaria control projects, that is easily available on LinkedIn also. Southeast Asia, you can get jobs in arboviruses surveillance. Arboviruses like Zika virus, like mosquito-borne diseases. In Australia, you can go for biosecurity and vector surveillance jobs. In Europe and USA, more research and academic opportunities are available for medical entomology. Conclusion: the study of medical entomology is integral to addressing public health challenges posed by insects. By understanding their roles as disease vector, we can develop more effective control strategies and prepare for the impact of climate change on insect populations. Continued research and collaboration in this field will essential for improving global health and mitigating the risk associated with vector-borne diseases. Thank you so much. That's all for today. If anyone has any question about medical entomology or the presentation or anything, he or she may ask, please.
Thank you, Mr. Nauman Altaf, for the insightful presentation. And we'll now move to a brief question answer session. Please feel free to post your question in the chat or use the raise hand feature to ask directly. We encourage everyone to participate in this discussion. Please, I request every participant to mute your mic. Just send your question in the text box. Thank you. So I will ask on behalf of you. Yeah, we have one question, Mr. Nauman. Please elaborate the latest promising chemistry for urban pest management. So we are just coming to the point. In the urban pest, there are a diversity of pests. So we just here is actually talking about the medically important insects. So what are the latest chemistry insecticides or the chemicals which can use for the control of insect vectors like mosquito and some other important vectors which are prevailing in the urban areas? Yeah, please.
Different chemicals are used for different insects. Yes, different chemicals are used for different insects. It's about the insect bionomics or about the insect life cycle. If we talk about the mosquito, then OPs or organophosphates are used in which alpha cypermethrin, lambda cyhalothrin are very good for adult control, and tamifos liquid or granules are very good for larviciding use.
Okay. We have some other questions. Okay, what advice would you give to students or early career professionals interested in pursuing work in medical entomology or vector control? So it's a general question. If you have, it's a short answer. I request, please.
What advice would you give to students or early career
professionals interested in medical entomology, or who is seeking careers in medical entomology, who want?
This question is divided into two parts. First of all, in my understanding, Abdul Moiz is asking how to become an entomologist or how to become a medical entomologist.
Yeah.
So for this purpose, you have to do the degree in entomology or medical entomology. If you do degree in agriculture entomology, then specialization can also be done in medical entomology. Specialization can be done in such insects that are equally important for public health purposes. So in second part of the question is in pursuing work for medical entomology, you can go abroad for PhD or MS opportunities, research opportunities abroad, very good research opportunities. If you like to go to UAE, then you have to acquire a certificate in UAE, and you can easily get jobs in UAE, Dubai. Neom City is also developing. Saudi Arabia is developing Neom City, in which a lot of entomologists are required, and a lot of Pakistani students, Pakistani medical entomologists are working there in Neom City. That's new and encouraging to apply there if you want to go abroad for the job.
So another question, what are the possible internship opportunities in medical entomology? So which institute or companies are offering the internships?
Research institutes like NIH offer internship, like in Lahore, there are research institutes that offer internships in medical entomology. You can also get internship in health department for dengue vector, dengue and malaria control programs. So there are several research institutes that offer internship in medical entomology.
Okay, someone is asking how to apply in Gulf countries. What are they actually? It's goes with the career point of view. So, in short,
It's
I suggest to answer this, please.
it's difficult to get job in Gulf countries from Pakistan. It's very difficult to get job from Pakistan, but you have to travel to there, travel to Gulf countries to get job in, because there is a certification required before getting the job or applying in the job in Gulf countries especially. So it's very difficult from Pakistan, but you have to go there, move there on a visit visa, and then get the certificate and apply for the job or work visas and etc.
Yeah, Mohammed Ahmed Baloch is asking that I have degree in agriculture and no, someone is Haseen Gul, that he has background in agriculture and entomology. Can he transfer in medical entomology?
Yes, he can transfer in medic. It's all about specialization. If he studies or like interest in medical entomology, then he can do diplomas in medical entomology. University of Florida offered free online diploma of 29 weeks in medical entomology. So it's all about specialization and a certification in medical entomology. So specialization required his interest, his study, his research or internship, and certification like University of Florida, Health Services Academy, NIH also offers, and IPH Lahore, Institute of Public Health Lahore also offers certifications and internships in medical entomology.
Another very big question, what is the role of Aedes mosquitoes in the transmission dynamics of dengue fever and Zika virus, and how can integrate vector management strategies be optimized to control their populations and prevalent disease outbreaks in tropical regions? I think it's it's a title of our next webinar. So I suggest if you just answer it
I
quickly
will
how.
answer very shortly. Uh, Aedes aegypti plays a very vital role in transmitting the Aedes, Zika, chikungunya. Aedes serve as a vector. It carries disease causing organism, disease causing agent from an other organism like humans or like monkeys. So it is very easy to control if we understand the life cycle of the mosquitoes. In the control of dengue, Zika, chikungunya, we have to control the mosquitoes. To control mosquito, we know about their life cycle, about their biology. So if we know about their life cycle, it consists of four stages: egg, larva, pupa, and adult. And it's in a favorable season, favorable temperature, it completes its life cycle in 7 to 10 days. So we have to uh, apply control measures in within stipulated time within 7 to 10 days. And it's easy to control mosquito during its immature stages like eggs, larva, or pupa, because it propagates or breeding in water. If water or humid habitat is not available, then it's not possible that mosquito may breed around us. Mostly mosquito fly about 200 to 300 meters. So if we clean our surroundings or remove the breeding the spots, breeding sites, so there may be a good chance that mosquito may eliminate or minimize then the disease also.
Yeah, sir. It's, I think, a very good answer from your side. We have only 3 minutes for more questions, so I will take one or two questions here. But I request all the participants who want to ask any question, if you join the webinar group, please, I will make the permission open to send messages. So one can go and ask the question in the group. If you could not find answer here, then inshallah our speaker will answer you there, either with the voice message or with by text message. So another question, or maybe the last one. Can we use sterile techniques in
I
Aedes? Can we use sterile techniques in
uh,
Aedes in Pakistan?
we can use SIT techniques to control insects, Aedes or any other insect, but it's very difficult and expensive to apply commercially. It's easy to apply on a smaller scales in lab for research projects, but in like country like Pakistan, under developing country like Pakistan with very short resources, it's very difficult to apply SIT here.
Okay, so now I just want to ask the last question. One is asking about how I become a good entomologist. So I please request you to also answer this question.
It's
How
very
how how
very
how when can
well
one
and
can become
very
a good entomologist?
good entomologist. Uh, if you want to become a good doctor, good engineer, good entomologist, you must know about your field. And it's not about bookish knowledge, it's also about the field and research and innovations to control the things, to control the insects here.
Uh, Now we are about to uh, end this webinar. So again, thank you very much, Mr. Nauman Altaf, for your valuable contribution and time and sharing the knowledge with us. And sincere thanks to all participants for joining us today. On behalf of the GEN team, we look forward to your continued engagement in future webinars as we grow this scientific community together. So stay connected and have a great evening. And in the last, I would like to say that this is our first webinar on the forum of the Global Entomologist Network. Maybe some of you are the members of this great network or this forum. And inshallah, we have many plans and there will be many opportunities for especially the young entomologists or the students or the early career professionals who are working or studying the entomological science. And inshallah, we will keep continue to do such great work for you. And we will arrange many webinars, or some goes with the career counseling workshop, or goes with some kind of related to research and scientific writing related webinars. Many things, inshallah, will come one by one. So again, I thank you very much, all of you. So it's about that we are about to finish this webinar today. And again, thank you very much. And inshallah, see you next time. Take care. Allah Hafiz.
Okay, Allah Hafiz.